Hello, and thank you for taking the time to watch this introduction about advanced health planning. My name is Kim Chartrand, and I'm the care manager for Hospice San Luis Obispo County. All of us here today represent various agencies in San Luis Obispo County that promote the completion of an advanced health directive and assigning a healthcare proxy to communicate your health decisions on your behalf in the event you're unable. Advanced health directives can be legally completed by anyone age 18 or older, and it is a living document. It changes with you over your lifespan. It's a powerful means of letting your loved ones know what kind of treatment you want in an emergency or at end of life. Advanced directives are state-specific and can be witnessed by two individuals or notarized. The directive we promote is called Prepare for Your Care, and the web link will be posted below. But there are many other types of directives to record your wishes. The important things that you can do are to fill out the directive and then assign someone to be your agent or your spokesperson, someone who's willing to advocate with healthcare providers for your wishes in the event that you aren't able to do so. I'd like to turn the spotlight to my colleagues who will speak from their perspectives and expertise. First up, we have Tom Fencemaker, a chaplain with Dignity Health. Tom?
Thank you, Kim. Hi, I'm Chaplain Tom, and I've worked in hospital care for 25 years, and I've helped to complete thousands of advanced directives. Why? I'll cut to the chase, because I have seen how most people put this off because they're too uncomfortable talking about their own death. We'll do it later. Well, I've seen later, and it looks like a train wreck. When they've pulled through all the feudal care procedures that rob them of their dignity and peace of mind, not to mention traumatize their loved ones who have to watch. I became a chaplain to help people through the disease process and at end of life in a way that avoids needless suffering. So make no mistakes, these train wrecks can be traumatic for you, your loved ones, and hospital staff, and often create a financial burden afterwards. Please, if not for you, do it for your loved ones. So at least informally, go through the advanced directive document with your loved ones or surrogate. And if need be, they can speak for you when you can't speak for yourself. And you could be treated with dignity. And I've heard 1,000 times, they never said what they wanted. Well, the default position, ouch, is full code and full care. Do everything. That should be a conscious decision, not the default position. Formally, you can formalize this advanced care document, and you can rest knowing that you have done all you can. And if you can't speak for yourself, you have chosen a surrogate who will have your back. My suggestion is get familiar with this Prepare for Your Care document, and then either one, get assistance completing it from someone like me, or two, go to their website and they will help you walk through easy step-by-step completion processes. Please take the opportunity to join us on Zoom for a question and answer period April 20th. We have scheduled dates and times at local libraries also, so you can get help completing the advanced directive and have it witnessed and formalized. Trust me, I have seen why too many train wrecks happen. So remember, an ounce of prevention is worth a pound of dignity and peace of mind. Thank you.
Thank you so much, Tom. I'm going to turn this now to Alexandra Morris, who's a care manager for geriatric care management, and also has worked with the Alzheimer's Association to speak to advanced planning and dementia.
Thanks, Kim. So, hi, I'm Alex. I've worked with people living with dementia and their families for over 30 years. When a person is diagnosed with dementia and is still in the early stage, that is the time to plan for the future. Unfortunately, Alzheimer's disease and most other related dementias are progressive. This means the person's cognitive abilities will decline over time. Memory, judgment, reasoning, and foreseeing the consequences of actions or inaction are some of the abilities that decline. When a person progresses to middle stage, the ability to have a thoughtful and complex conversation about future care needs and what they want and don't want at the end of their lives is likely gone. Therefore, the time to create or update your advance directive and have the discussion with your loved ones about the advance directive is in the earliest stage. This is when the person living with dementia is at their best. Through the Alzheimer's Association, I facilitated support groups for many years. On a regular basis, we discuss the benefits of completing the advance directive and having family discussions on the person's wishes. Over the years, many families thanked us for encouraging them to complete the documents and having the conversations. It made those decisions at the end of life so much clearer and often resulted in positive outcomes. There are addendums to supplement your advance directive specifically for people with dementia diagnosis. Along with your advance directive, these documents will better inform your agent what you would want in each stage of the dementia. We have attached a link to one of those documents. Thank you.
Great, thank you, Alexandra. And next up, we have Linda Beck, who is a patient advocate.
Thank you, Kim. I've worked with many families and patients over the years, and end of life is a very emotional and difficult time. It makes me appreciate all the more the gift my mother gave me. She was very clear about what she wanted for end of life care, which is essentially to be kept comfortable. And she had followed through and done an advance directive, naming me as her health advocate to speak for her if she couldn't speak for herself. So when in her 80s, she was in the hospital for the third time with a condition that wasn't responding to treatment, it was very easy for me to tell her doctor that my mother wanted to have a conversation about all of her end of life options, including hospice care. She was able to come home. She died in her own bedroom with her cat on her pillow, which was what she wanted. And that was a great comfort to me. So when I am talking to people about what they can do to reduce the difficulty of end of life for themselves and for their loved ones, I always encourage them to have the conversation about the care they want and to follow through doing an advance directive like the one that we're promoting here, and to do it now.
Thank you so much. I appreciate that. Especially as a hospice nurse and a care manager, I see people each week, families having to cope with end-of-life decisions, and they benefit when a loved one's been clear about their wishes for treatment and their care at the end of life, no matter what those decisions are. And it can be sad to consider the end of one's life, including our own, but we feel that completing an advance directive is so important to having your wishes upheld when you're unable to uphold them yourself. And many people perceive it as a depressing affair, but it can actually be an empowering experience because you're considering the treatment that you want to receive, and you get to appoint a trusted individual that you know with confidence will uphold your wishes and strongly advocate for the care that you want when you're unable. I've had family members and clients who won't mention their wishes, and it's every bit the train wreck that Tom mentioned it was. I've also had family members and clients who are very clear in communicating, and when I've been power of attorney, just as Linda has been for her mother, it's been a privilege to speak on my loved one's behalf because I'm communicating their wishes to their healthcare team. And it also was able to dispel dissension between family members about treatments because it was always about upholding the loved one's wishes. And who can argue with that, even if we don't agree on what should be done? The end of life has its own difficulties, as we all know, but having your advance health directive completed and clear, it'll be a part of the time of life, that part of the time of life that will bring some peace of mind. Now for some closing words, I'm going to return it to Tom.
Thank you, Kim. Remember, you never know what will happen tomorrow, and that an advance directive is a fluid document that changes over time. I personally have redone mine at least 6 times since I was 30. Our hope is that you will be treated with dignity and respect over your lifetime. no matter how you choose that to look. Thank you.
Thank you so much. Thanks, everybody. And if this conversation has brought up some questions for you, I encourage you to write them down. And then, as Tom had mentioned, join us for a live question and answer on Wednesday, April 20th on Zoom from 10 a.m. to 11 a.m. And you can ask your questions to a panel of experts in this area. Also, we'll be providing a recording of this event. If you aren't able to attend, you can at least hear what other people are asking. We also have live in-person events happening at local libraries and also at the Paso Robles Senior Center, in addition to the Meals That Connect dining sites, various ones. For more information, you can call 805-544-2266 and get some more information. But we hope you'll join us on the 20th and at the events and fill out your advanced health directive. Thank you, everybody.